Thinkwell works across a number of other countries and also works to generate evidence to inform UHC reforms. What do we know from other countries about implementation of similar reforms on social health insurance? What has worked and what hasn't? Over to you, Felix.
Thank you, Dr. Anne, for that question. I think from the discussion that far is that the source for the money is a big problem. So there are many lessons that we can pick from the low and middle income countries on the experiences on implementing social insurance schemes. And definitely one of those that I would like to focus on right now is revenue raising. Moi has mentioned that the new social insurance bill proposes mandatory contributions from more Kenyans, including those in the informal sector based on the ability to pay using means testing. This is good. However, the NHIF Act of 1998, for example, and even the attendant amendments, including the most recent one of 2022, maintained the same mandatory contribution requirement. While this has been working well with the formal sector, it has been challenging to collect premiums from the informal sector, which Dr. Moi has also mentioned, constitute over 80% of the Kenyan labor market. Evidence has shown from other countries in our context, while enrollment and contributions could be mandatory in law and in policy, in most countries, it has been problematic and difficult to implement in practice, often resulting in poor population coverage, low retention rates, and even advanced selection, which further entrenches inequalities, inefficiencies, and even problems of financial sustainability, which I think has been mentioned as part of the problems the new social insurance bill intends to solve. We have seen countries like Ghana, for example, and Gabon, which have comparatively higher social insurance coverage, are often characterized by tax-based revenue raising and less contributory mechanisms, whether mandatory or not, which other countries mostly did not employ. Literature has also shown that the enrollment in social insurance schemes has been correlated with the ability to pay. And you have heard Dr. Moi mentioning that the payment will be based on means testing results to determine how much households can pay. It goes then that access to benefits is based on contributions. And evidence is showing that consequently, there is movement towards selecting higher socioeconomic individuals, further promoting inequity. I do think that as the country moves towards implementing the new social insurance bill and implementing a raft of changes, and this being the very first time that we have seen the government taking deliberate decisions to actually enforce mandatory payments, to pick lessons from these countries so that policymakers, advisors, and other people within the space for implementing government policy on health will have to contend with these issues about ensuring that we can finance sustainably the social insurance scheme. And also the design that we come with is able to mitigate the consequences that I've just mentioned to improve population coverage, service offering, and to promote quality and equity.